Did you know that an average person sits for almost 10 to 12 hours in a day? Did you know that sitting causes a lot of deleterious effects on your spine in the long term? My name is Dr. Umesh Srikantha, and in this particular video, I'm going to tell you about the harmful effects of sitting for prolonged periods, what happens to your spine when you are sitting for long periods, and what is the beneficial effects of changing your posture frequently. Now, when you consider sitting, forget about the effects that it has on other organs. If you sit for long periods, your muscles become stiff, your joints in your body become stiff, and this aggravates or increases your aging process. This can be harmful to your spine also in the long run. Now, what effects does it specifically have on the spine? So even if you're maintaining a good posture and if you sit for a long period, so the weight bearing that happens through your spine, because of the constant loading, there can be a lot of pressure which accumulates over a period of time in the disc spaces and or the joints in the spine, and that can cause advanced or aggravated degenerative processes. Now, these discs are avascular structures and they depend upon movement for getting some nutrition from the surrounding tissue, for diffusion, which happens through diffusion, and that also gets affected. So the discs receive less nutrition when you are sitting for long periods of time, and also can stiffen the joints in the back of your spine, which can go into a locked state. And that is why if you sit for a long period and when you get up, you always tend to stretch. Oh, your back, there is a catch in the back, and you stretch, you move around for 2 to 3 minutes, it is all going to be fine. That is what happens. Now imagine when you are not maintaining a good posture while sitting. We sit with one, leaning towards one side. We sit with legs up. We sit with, half reclining position. So there are different postures that we avoid, which are again deleterious. The forces that are transmitted through the spine, again, if this bad posture is maintained for a long time, these abnormal forces are transmitted through the spine for a long period of time, and they can also cause serious problems. They can cause core muscle weakness, they can cause advanced disc degenerations, and they can cause even disc prolapse in some cases. Now, what do we do? How do we prevent that? It's quite simple. We have to maintain a good posture, and we have to change our posture frequently. Your next posture is your best posture. If you maintain this posture for a long period of time, again, it is not good. Once in 30 minutes, you get up, take a small walk for even 1 to 2 minutes, 2 to 3 minutes. Or you can do sitting exercises. Just stretch a little bit to the right and to the left. Just do twisting exercises. There are a lot of exercises that you can do while sitting on a chair itself. That actually decreases the deleterious effect of prolonged posture in a significant way. And this you can practice wherever you are. So, number one, maintain a good posture. And number two, even a good posture for a long time is also not good. So you have to keep changing your posture very frequently. So these are the two things. Now, there are other things that you can do rather than just sitting. So improve your core muscle strength, and that can be done by doing regular exercises. Avoid any stress and strain while bending, while lifting objects. Of course, we have to do these activities, but there is something called as responsible lifting. Means the way in which you are picking up objects from the floor, the way in which you are carrying heavy objects. So all these, there are certain guidelines, and these have to be followed in order to avoid abnormal stress or strain on your back. So we sit for long periods, that is inevitable, but we have to take appropriate precautions to prevent this sitting posture affecting our spine in a bad way over the long run.